welcome back to A Singleton of Smiles,
where your smile is your best asset.
So today we're doing a video where we went to the Detroit Mercy campus and we answered some questions for the Undergraduate Student National Dental Association chapter there. And these are a group of pre-dental students. They gathered a list of questions that they had for us. So we prepared a little PowerPoint just to answer those questions for them. So that's what this video is going to be about.
Yep. Hopefully the answers to the questions that they asked will be helpful to you as well as you are matriculating through your undergraduate programs and eventually into dental school, because you got this. I feel it. You got the juices.
Shut up.
You got the juice.
So if there's any question that we weren't asked that you might want to know, please leave it in the comments below. We will be sure to answer it.
Yep. Yeah, you don't have anything to pull.
And remember, as always, please subscribe to our channel. It helps us grow on YouTube. Like this video if you find it helpful, and leave some comments below so that we know what you guys are thinking and what you found helpful or what you need a little bit more help on.
Absolutely.
We're here to help and we love helping.
Exactly. All right, take care. Enjoy this video. So who are we? So my name is David. I'm a fourth year dental student at the University of Detroit Mercy's Dental School. And
I'm Jessica, fourth year as well.
We've been dating since March 2012. We got married in August of 2016, so we got married in dental school, our second year of dental school. We actually met in Tallahassee, Florida State is where I graduated from. Got a bachelor's degree in biology. We deployed to Afghanistan. We were in the Army National Guard prior to starting dental school.
We wanted to apply for the Army scholarship, but since we were already in the Army, the process for us to apply was kind of long. So by the time we got to the point of applying to it, all the scholarships had been taken. So we still wanted military scholarships nonetheless, so we looked into the Navy scholarship, and that's kind of how we got into the Navy scholarship. Also, we have a 21-month-old daughter named Kalia.
Why didn't you guys bring her?
She's in daycare right now. She would have been all over the place. And so we asked Tony for you guys to give us some questions. So this presentation is basically going to be a reflection of what you guys wanted to know, so the questions that you guys asked us. So that's kind of what this presentation will be about. So we'll start it off by kind of answering how do we balance life in dental school. So I'll let you kind of start off with that.
So basically, first year of dental school, we didn't have a life. Studying was life, that's all we did. And with us, classes weren't mandatory, or if they were, it didn't count enough to where we would want to go. So we skipped a lot of classes just so that we can study for that class and other classes, because the lectures are recorded. So that worked out for us. And I guess that's kind of how we balanced first year by just not going to class, studying the lectures.
Which that's not the biggest takeaway, but like she said, you know, the lectures are recorded, and I think in dental school, you're basically like in a classroom like this, and a lecture, you're like in lectures all day. So when I first started dental school, I was like, you know, I'm pumped, I'm going to be a good student, I'm going to be in class taking notes. I didn't even make it through the whole day, you know, I wasn't able to make it, you know. So it's good that the lectures are recorded. And things are constantly changing. Like I said, we're fourth year, so the process that the first years are currently going through now may be a tad bit different, but the lectures are still recorded, so that's good. And you just kind of have to gauge what type of learner you are. So for me, I can't necessarily learn while you know, professor's up here lecturing for an hour and a half. So the ability to like pause, take notes, that was kind of better for me. And yeah. Then came Kalia, second year, so the winter of our D2 year is when she gave birth to our daughter. And one of the good things that I like about our school is that they're very accommodating. She went to them and was like, I don't want to take off a year. I want to continue on with the program. And thankfully, she was able to catch up with everything. The professors were super cool about it. So that's one of the things that I like about our school.
So I had Kalia the semester before we started clinic. Some people did take off a year after they had a child. A lot of people didn't. So it just depends on you and what you feel like you can handle personally. My sister, she came to live with us for 6 months, and that was a big help. So she was able to watch Kalia while we caught up with school and did everything like that. So that helped with that aspect. I took off just 3 weeks, and then I went back. And it was easy for me because we have each other. So he was able to keep me up to date with the sim lab stuff. So it works as long as you have a support system.
Yeah, have a planning process. And then 3rd and 4th year is really what everyone is excited about. Obviously, that's what you came to dental school for. And so lots of clinic time. Once you hit 3rd year, you're in clinic from 8:30 to 5:30 every day, except on Fridays. We just have clinic from 8:30 to 12:30. And like it says here, weekends are ours, 3rd and 4th year for the most part. 1st and 2nd year, you're doing a lot of studying. You're in the classroom a lot. But 3rd and 4th year, you definitely have a lot more leisure time.
And then another thing with balancing everything as far as like having a baby in school for females, if you want to breastfeed, then that's another thing you have to consider, because in between classes, like we would have 10 to 15 minute breaks between classes, so I would use that time to go into a private room to pump breast milk for my baby. And then when I got to 3rd year, it got harder because I had a patient from 8:30 to 12:30, let's say, so I would only have time to pump during my lunch break. So that's something to keep in mind too if you're thinking about having kids in dental school.
All right, so this is kind of like a little snapshot of how our day looks. So typically, we as 4th years, we wake up at about 6:30, so I wake up, I get my daughter ready. So the routine that we have is that I wake Kalia up and I change her.
He
I
does
get
that
her
while
dressed,
I'm getting ready.
and then she does her hair. So that's the kind of that's the little balance that we have
And
there.
then, when he's done getting her ready and I'm done getting myself ready, I go and I do Kalia's hair, because if I don't, and I let David do her hair, that's what happens when he tries to do her hair.
Well, I was like in the process of like putting in a ponytail. Yeah.
Just the messy.
Yeah, the messy look, right? We have to leave at 7:30 to drop Kalia off at daycare, and then make it to school and make it to clinic by 8:30. And we're always typically pushing patients 8:30 to 12:30. So like I said, as a 3rd year, we're seeing patients from 8:30 to 12:30, and then from 1:30 to 5:30. And that is 3rd and 4th year. Depending on if you have lab work, sometimes you'll stay at school after to complete those tasks. But otherwise, we typically try to get out of there by 6 because we have to pick up Kalia at 6:30 from daycare. Working out on Tuesdays, she has sometimes dinner here because she's not cooking right now. Until she's pregnant. And if she doesn't cook, I don't eat. So.
The next question you guys asked was, what are your future goals? So right now, we graduate on May 10th, and right now we're looking into Navy GPRs, which is a general practice residency. And that's just like hospital-based. Basically, it's another year of dental school, but you're a doctor. But you're just getting more familiar with like surgical procedures in the hospital, working with medically compromised patients and stuff like that. So we're looking to do something like that for a year with the Navy specifically.
Also, contrast, after you graduate dental school, you have the option of obviously specializing if you want to specialize, or you can do the general practice residency, which is what we're applying to, or you can do an advanced education in general dentistry residency. And so the difference between the advanced education in general dentistry residency and the GPR is that one, like Jessica said, the GPR is hospital-based. So with the GPR residency, what you're going to be doing, you're going to be seeing more medically compromised patients. You're going to have different medical rotations. So you'll have like, ENT rotations. You'll rotate through ENT. You'll have the anesthesia rotation. Internal medicine. There are some times where you'll be on call like for an emergency.
Just really quickly, what makes a patient medically compromised?
Sure. So a medically compromised patient is a patient, and being in Detroit, in the inner city of Detroit, we see a lot of medically compromised patients. And those are patients who have lots of different medical conditions. So for instance, hypertension, diabetes, they may have prosthetic joints, so knee replacements, hip replacements. HIV, AIDS, high cholesterol, I already said diabetes, cancer, history of cancer, multiple sclerosis. So these are lots of different medical conditions.
And some have a
patients
combination
present.
of a lot of them, a lot of
Exactly.
the medical conditions. So.
And from a dental standpoint, like lots of people may not think, that is not relevant to us from a dental standpoint, but it actually is because the medications that they take can sometimes impact our practice. So we see a lot of that at the dental school, having to manage that. And in a general practice residency, you'll also be exposed to that as well. With an AGD, it's more clinical based. So Detroit Mercy has an AGD residency. We have one at our school. And it's more clinical based, so that truly is more like a fifth-year dental school because they're typically based at dental schools. So you're at a dental school, you're seeing patients. Some of them generally have like requirements that you have to meet. So that's kind of a quick snapshot of the differences between the two. And then our 5-year goals. So definitely I see myself, continuing on in the Navy. Just learning, honing my skills as a dentist. And then eventually we do want to become practice owners together. So that is our 10-year goal. And obviously we want to get all of our debt paid off. Being Navy scholarship recipients, because we are Navy scholarship recipients. So that kind of offsets some of the debt that we would be expected to pay after we graduate. And Tesla owners.
So that.
Yeah. The Teslas are nice. Have y'all seen them?
Yeah, they're
Model
nice.
X with the wing doors.
Yeah.
Wow. Y'all are laugh.
We're as far as the Navy goes, we didn't know like our 5 and 10-year goal because we don't know if we want to retire in the Navy yet or if we want to just do 4 years and then get out and open a practice.
If you were not in dental school, what would you be doing? So, our initial interest to one another was pharmacy. So we were both interested in pharmacy. Once we came back from our deployment in 2013, we had planned to begin the pharmacy program, I think the following year. How do you gain confidence? Then we'll talk about that.
So basically, well, this was David's answer, so I don't know why he did it for me. But practice and repetition. So basically, the more you do something, obviously, the more comfortable you get with it. When I first started clinic, I was nervous, especially doing my first filling. I remember it. It was a nerve-wracking experience, but I mean, I did it and I got through it. And the more you do it, you get comfortable. Now I'm just, I'm comfortable with it. So basically, that's how you gain confidence by doing.
Yeah. And that can be applied to like anything. You're interested in dental school, and you're fearful because it's like, oh man, I'm competing against so many different people. And maybe my grades aren't the best, or maybe my background is not the best. Whatever the situation, whatever your specific situation is, you may not feel as confident. But I mean, it sounds cliche, like to say that face your fears, but literally, like she said, once you can get over the fact that, okay, I got an interview for dental school, I'm scared, I'm terrified, but you go to it, you do it, you get it done, and then that next interview kind of gets a little bit better. So, I mean, it's simple, but I think it's worth noting.
Did you plan to have a family in dental school? I did, more so than him. I just knew I wanted a baby. And so before I even started dental school, I asked a lot of people, a lot of females who are already in dental school, who are already dentists now, and I asked them if they thought I should have a baby in dental school. Of course, a lot of them said no, which is not bad advice, but obviously I did it anyways. And it worked for me, so I'm glad I did it. But yeah, we did plan to have a family in dental school, and we were engaged before dental school, so we knew we would be married while in dental school. So yes,
She makes it look easy.
Easy.
But I feel, I mean, you can definitely do it. It's just a matter of like, how much do you want something, And so your drive, your determination, your why you're doing this. And I mean, hats off to her for doing it. I mean, keeping up with everything, managing requirements, staying on top of, I remember when we had Kalia, that semester, toward the end of second year, we had a ton of finals. And, we still had a newborn, which my sister-in-law, she was a great help. But just trying to juggle all that, thinking back on it, it's like, wow, how did you get through it? But,
Yeah, we had finals and boards that we were studying for. So you guys asked about our YouTube channel and our motivations for that. And it's family because his mom and his brother, they're both doing YouTube. My sister, she's doing YouTube. So just seeing them do it and they're like talking us into it. And then we saw other dental pages, we were like, why not?
Yeah.
That and the fact that we like to help, so why not help on a bigger scale? So that's our YouTube channel there. So if you guys aren't following, make sure you follow.
A single ton of smiles. Yeah.
Yeah.
How do you all find time? I don't know if that was a question already, to juggle it all. The job.
Sometimes I don't even know.
Yeah, we
It's
don't
like,
either.
You know,
We don't
it's
either.
just like you know,
It's
it's
hard
like
to
you do
answer
it.
that question.
I feel like we take it day by day. You know, like now, like we haven't posted a video, a YouTube video.
Cause y'all post Wednesdays and Saturdays?
We were supposed to do Monday, Wednesday, Friday, but
So that's probably, yeah. So as you can see, you know, we started off strong, but now, you know, we post a video here and there. But yeah, I mean, sometimes we have our good days, you know, where we're able, like we're eager to do, you know, things and we can get stuff done. Sometimes not so much so. Like for the past few weeks, we were like preparing for our boards, the first part of our boards, and then patience and then being lazy. And then now she's about to have a baby in 3 weeks. So, you know, but you kind of fit it in, you know. What do you do to stay motivated? So obviously we have one another, so we kind of lean on each other for motivation, especially now it's a little bit easier. We're at the end of the road, so it's kind of like, hey, you know, this is do or die, you know, we've come too far. But in those first 2 years, you definitely, you know, have to, I mean, obviously everybody's not going to be married or have their spouse with them in dental school. You definitely have your friends, you know, you make friends in dental school. So, you know, you lean on your classmates and all of you guys, so dental school is it's different, it's much different from undergrad because in undergrad you choose your own classes, you choose your own schedule, you choose what professor you want. And in dental school, you know, you have no control of your schedule. They send out the schedule at the beginning of the semester, and that is your schedule. If you don't like the teacher, oh well, we have a teacher at dental school now. But we've been trying to, everybody complains like consistently about her every semester, and she's still walking around. What do you look forward to in dental school? So obviously for us, graduation, right? May 10th, we can see the light at the end of the tunnel. Right now we're managing requirements, so when you get to your third year, they have like this list of requirements that you have to do. You have to do so many crowns, so many dentures, so many fillings, X, Y, and Z, right? So we can see the light now. We're kind of checking those things off as we speak. Graduation. When you're a first year, I know for us, the cadaver lab was exciting to me because you go in, you're dissecting a cadaver. The second semester of your first year.
I look forward to just using handpiece for the first time. It's really not too. This is coming into dental school. Yeah.
So yeah, definitely that first time when you're in sim lab and you can use the handpiece and kind of get back to like reminding you, oh, I am in dental school.
Stab lab.
When in your second year, you guys practice injections on each other. So Jessica and I were each other's partners. So she stuck me, she stabbed me, and I gave her the injection.
You can see that.
Because I actually got you numb.
He did. And I was pregnant, and he gave me all this anesthesia, and I was going easy on him.
Yeah, I think she only gave me like a few drops. I gave the whole part. I took advantage of my experience.
What are your concerns of giving 4 years of service? So overall, we're not concerned because, like we said, we have a history in the military, and we have deployed, so we're not worried about any of that, like in terms of being scared or anything like that. But we are thinking about the pay, because a lot of people say military dentists don't get paid as much as civilian dentists. So we are concerned about that. Long term, if we do retire, we're concerned about having to relocate so much and having kids in school. So that's another thing that we think about as far as the military.
So you guys gonna have to serve 4 years? That just because you're in the Navy or Army?
So it's 4 years because they're paying 4 years of our dental school education. So in exchange for that, we have to repay that time.
Yeah, but you said you're gonna, like, your 5 years goal is to pay off your debt, so Did they pay for you like in full, or did they not pay for you? Because I get like 2 phone
Oh,
calls
no.
per week.
So
like
so
being
we
recruited.
so we do have debt. It's just not as much. So we have taken out some loans.
Especially like in undergrad.
Yeah, and in undergrad as well. So
Oh, it's
those loans
undergrad.
have carried over. And even though the military paid for our school in undergrad, we still like every semester took out some loans. So we won't have nearly as much debt.
You go into dental school, so, like you being part of the Army, you too. Do you guys sign a contract for that?
Yes, you did sign a contract before we started dental school. He commissioned and I enlisted because we have 2 different scholarships. I'm active duty right now and he's not. So our scholarships are different, but we did have to sign a commitment. Once you finish dental school, you serve 4 years.
Would that be like in underserved areas?
No, it's just wherever there's a military installation and they send you there.
Can you guys talk about your deployment and what that experience was like?
So we deployed in 2012 to Afghanistan. When we got there, our mission was construction. So we basically had to like build things up, tear things down. He did electricity stuff.
I was an electricity stuff.
So, I mean, it wasn't that scary for us because we were in the safe haven of the military base, basically. But he had a scary
Yeah, so we went on a convoy, which is basically, so when you deploy overseas, like in my mind, I always thought that like war was just like a whole bunch of people, like kind of like the Civil War you see in textbooks, like you have, you know, one side on this side, one side on this side, and everybody's like,
Yeah, I think that's what a lot of people
you know?
do with the army.
Yeah, you know, so it's obviously not like that. So you go over there, there's like a base. So if you're familiar, like even in the United States, we have, you know, military installations, military bases. So it's much the same when you go overseas. That's kind of like the safe area. Obviously, people can bomb the base or like infiltrate the base, but that's typically the safe area. And then, so for us, we typically flew everywhere we went, which wasn't really a big deal. But two times in particular, we had to do a convoy, which is basically we get in like the military armored vehicles and we drive from one base to another. So when you go on the convoys, that's typically when you can encounter danger. So make a long story short, in Afghanistan, like it's desert, and it's as far as you can look around you. I remember like it was just sand, like no trees, no houses, nothing. It was just like sand, and the sand was just like soft, and it was like deep. Like if you step in it, it almost came up like to like mid shin. And so our trucks got stuck in the desert. We were stuck for hours, and so we had to wait for the Marines to come to kind of tow us out of the sand. And we were basically like sitting ducks. So I mean, anybody could have like come up on us. Thankfully, nothing ever happened. But yeah, that was like the scariest experience. But other than that, I was just on, like I said, we flew to different bases. And I was an electrician. I worked with other electricians, and so we would like wire like the lights or air conditioners or receptacles.
But as far as like military dentists, if you are deployed as a dentist, I did see a dentist while I was in Afghanistan. I think I got a wisdom tooth pulled. Dentists are usually on the base, so they don't go out in convoy like he did. Or, I mean, you could fly to different bases if they need you, but you wouldn't be in a convoy, so to speak, unless you're like combat or something. But for the most part, yeah, dentists will be safe on the base. And like he said, the base can get attacked, but yeah, for the most part, you're safe as a dentist. Don't worry, you don't be shooting. All right, so that's all the questions that you guys had to ask.
How do you deal with a lot of stress, especially when you're pregnant, you know,
I don't know. I just don't think about it. I just try not to stress. I really can't say. I can't even think of.
So she likes
Yeah.
to watch TV
Yeah, like
and eat.
Oh, come on. Come on.
Just playing, but
She
she.
gains just as much weight.
Okay.
Yeah.
Like you said, just do things that you enjoy doing to not think about the stress.
So you're talking about the GPR and the AGD?
AEGD,
AGD. So the first one is hospital based, the other one's what?
clinical based. So it's more likely to be at a dental school. So at a dental school, you're like in a clinic, and you're just like I said, it's kind of almost like a 5th year dental school, so to speak.
Okay, is that 5th year is mandatory?
No, it's not mandatory.
So you can like go somewhere else and start practicing?
Absolutely.
Is
not
that,
mandatory.
Is that paid for?
So in the military, it is. So if we get accepted into this residency program, my salary will be the same regardless if I'm in the residency or not. Now, on the civilian side,
It's much less.
it is much less. So
It's
you're not
like
going to
less than half of
Yeah.
what you're, so in dental school, we don't make any money, we're just incurring that.
Yeah.
But as a GPR, AGD, some of them pay like 50 to 60,000, which is like, you know, average salary for a
Yeah.
regular person per se, but you still have to account for the fact that you have these large amount of loans that you're paying off, and you still need, like, you know, your standard of living, you want to keep up, things like that. But it's not dental school, it is paid for the most part.
more questions. We kind of have to run to get Kalia out.
Oh.
Yeah. If you guys have any more questions, you can take down our email, email us, and
Follow them on their YouTube page, guys. It's very
Definitely
insightful
follow
for
us.
pre-dental students.
Yeah.
Super.
a single ton of smiles. Definitely subscribe, like, comment, all that good stuff.
We had a student who was interviewing at the school find out about a program that SNA offers through their YouTube
Yeah,
page.
that was pretty good.
Yeah.